Hi everybody, it's Adam from the Rural Health Workforce Transformation Hub, and in this video, for all you rural healthcare providers in Alaska, I'm going to be breaking down Alaska's application to CMS for the Rural Health Transformation Program to help you understand what they've applied for and how you can take advantage of the funds and grants when they come out.
All right, so let's break this down. This is the State of Alaska's Department of Health, and you can see here on their Rural Health Transformation Program page, they've got several helpful links. So you can sign up for updates from them there, and you get a summary of the application here. So they've got 6 proposed initiatives, and if we open this, we'll be able to see them all. Now, on, I think it was November, it was November sort of 5th, whenever the deadline to propose these was made, Alaska only really had a 15-page document, but they've recently updated it to be a much longer full disclosure. So I'm going to jump into that and talk you through the workforce components. I encourage you to read this as well to understand for yourself what's going on, but you can see here they outline geography, people, infrastructure, tribal health, that's a big one, and target populations. Then if we scroll down, we can see number 5, strengthen workforce. So let's just look at target populations. They have made a chart which shows that pregnant and postpartum women in rural communities, underserved children and youth, behavioral health, substance use disorder, chronic diseases, rural older adults, individuals with complex needs in rural settings. So they don't have, it seems here, a specific focus on their tribal communities because there's so many. And it's kind of baked in across every section of their proposal. You can see here they have a tribal healthcare system, 193 clinics, 93 behavioral health, 8 hospitals. So if you're a tribal organization, you're really baked into the fundamentals of this plan. So let's go down to see what they're going to fund under workforce. So first, I like to see what's the money. If we scroll down, we can see the estimated funding for workforce is 66 million. Okay, 66 million going into rural Alaskan communities for workforce. And we can read here what they plan to do. So there's 3 kind of primary focuses. So developing sort of training pathways, high school to career programs, graduates, reskill, upskill, targeted signing and retention bonuses tied to 5-year commitments, and then enhancing retention and provider support through structured mentoring, etc. So really focused on grow your own workforce, it seems, grow your own, like local Alaskans coming into healthcare careers, relocating, so bringing people from cities in Alaska into rural communities or from outside the state, and then retention as well. So once they're there, how do we keep them there? And I think this is a pretty good play, that they're acknowledging the importance of signing and retention bonuses to get people to come into communities, and calling out that relocation is a key theme. Some states we've seen haven't done that, but we know in our experience, we've done a lot of work research down in Sitka, that Alaska is a really attractive place for a lot of people to move to. They just don't really know about career opportunities there yet in rural environments. And that's something that these funds can be used to do. So marketing outside of Alaska and getting doctors, nurses, other healthcare staff interested in Alaska. So I'm going to go down and show you some potential uses of funds which your organization might be qualified for, so you can create or grow your own high school certification programs. And this isn't just for education providers. A big theme of the Rural Health Transformation Program is collaboration within regions and communities. So if you're a home care agency or a rural health clinic, definitely start engaging local education providers to tell them that you're interested in collaborating on this grant opportunity, to see what they're doing in terms of stipends, distance learning options, and see if you can help them out with that. So by providing placements, providing skills and expertise, training, coming in and doing trainings yourselves, that really helps people get into your pipeline. And you can see there's a variety of professions funded there. So whilst you're not often directly looking at this, I think organizations can really think, well, how do we chip into each of these? How do we engage high school students? How do we provide sources to education providers that tell them about our field, and in doing so, tell them about us? Fund or expand training workforce development. So that's kind of for your existing staff. You can see there that particularly upskilling, so going from CNA to licensed practical nurse to registered nurse, and so on. That's a great category if you have staff and you want to fill kind of expanded positions and get them up the seniority ladder. This one's a big one. So adults who may not have considered healthcare careers, they're going to be funding communications and flexible training pathways to make people interested in that. Residency as well, expanding that for physicians. And then recruitment and retention strategies, technical assistance and grants to implement recruiting and retention strategies within and outside Alaska. This is a big one outside Alaska. A lot of people willing to move to Alaska, and with an emphasis on remote and frontier communities. So if you're up in the Northwest, say Bristol Bay, for example, then you're going to be emphasized here and prioritized, which is great news. Now, this one I'm a little bit torn on. It's great that they're funding recruitment and retention grants, but if you look at some of our other content, I don't see that as a magic bullet, because often a physician can earn more over 5 years in an urban community, even if you're giving them a $50,000 relocation retention bonus. And asking them to come in for 5 years up front is quite difficult. So we'll see how that plays out. I think if you're doing a relocation program, which I encourage you to do, you're going to have to fit into this category. So you're going to have to offer some kind of relocation retention bonuses, but I do encourage you, don't just throw it all into the bonuses, because you need to have marketing on the front end that gets people interested in those bonuses and gets them actually into your pipeline before they even apply. Whenever they do apply, you need to treat them well, you need to respond to them, and you need to give them, roll out the red carpet, as I like to say. A few more here: expand scope of practice, launch housing placements. It's a big one too. Integrated housing programs, I know, is a challenge in Alaska when it comes to accommodation. So if you're looking to fund residencies in your area, like accommodation, or partner with local housing providers, this is a great way to do that. We're going to see whenever an RFP comes out what exactly they're funding on these, but I like how they're lacing in technical assistance to training to help organizations. So I think it's looking strong on this. So here you can see a list of stakeholders, and on the outcomes, it's interesting. They haven't put an exact number on it, but see increase in physician residency, a big focus on doctors here, not really a lot of focus on nurses, although I'm sure that they still recognize the importance of nurses. But yeah, physicians kind of front and center alongside CHWs and CHAPs. I like how they have here just a bonus, really, more supported initiatives offering recruitment incentives. So this grant's going to be quite open, and when it comes to apply, you need to recognize that and come up with something creative, right? Come up with something inventive and bring in different partners. We're going to make another video when it comes out and help you understand really what they're going to be funding. So that's the breakdown of the workforce component of this. You can see there's 6. So your organization is eligible for all of these if you're in rural healthcare. Let's jump down to implementation plan. So I'll scooch over to number 5 here. So they're going to do things starting in Q2 26. So they're going to do an analysis at start of Q2, physician residency Q3, and then the recruitment and retention initiatives are actually Q1 2027. So we've got a year to go into that, and the contracts for those will be concluded in Q1. So you got a bit of time to prepare, which is good. And if you're going to start working on this now, I would look at physician residency. How can you pipeline plans and activities around that? Engage the state. You saw that they have their newsletter. and really just think about how you could pipeline for that. What preparations can you make? A lot of focus on physicians. Moving into 2027, you can see they've got more of those training workforce components happening. And finally, it seems they want to join the licensure compacts for key positions too. So got a bit of time to prepare for this. But it's always good to prepare, get ahead of things. And I encourage you to read this document and follow along with us at the Rural Health Workforce Transformation Hub. Got a big focus on Alaska because we have done some great work down in Sitka with search, and we're very happy to give you support as you do so. So you can reach out to us via our website, nurserecruitmentx.com, or you can email me at nurserecruitmentx.com, or catch me on LinkedIn, Adam Chambers. I'm posting a lot of content there too. So thank you for watching, and I hope you find this useful as a rural healthcare provider in Alaska, and do keep up the good work.